is the president and CEO of a nonprofit called Darkness to Light, which is about child sex abuse prevention. In fact, she has been doing activities related to lobbying for public health and childhood sex abuse prevention and other causes, very much on the DC scene for lobbying. She's also been very heavily involved in domestic and international public health activities with numerous public health agencies that are coming across on her CV. And I'm very pleased to tell you, if you didn't already know, that she is working with the CUNY School of Public Health. She's also a distinguished scholar of the CUNY School of Public Health, and she holds master's and doctoral degrees from Columbia's Mailman School of Public Health. I'd like to introduce Dr. Lyndon Haviland to speak to us tonight. Welcome.
I worked very closely with the Global Leaders Council for Reproductive Health at the Aspen Institute. Mary Robinson, who was the former president of Ireland, was the woman senator in the Irish Senate when she asked that Irish women should have access to family planning. And she's been a long-term public health and reproductive health advocate. So we started a thing called the Global Leaders Council, where we got African leaders and Asian leaders and to talk about the link between family planning and economic development, between family planning and national security. And we came to Washington, we went to the UK Parliament, we went to the Norwegian government to ask for additional funding globally for reproductive health.
So I think social entrepreneurship is fascinating, and actually what we're seeing right now, what you're seeing in Africa and in global development in general, is it's a movement towards entrepreneurship and away from charity. The old paradigm, if you will, of global health was funding from the north being given to the south. And now with the rise of social entrepreneurship, what you're seeing is African entrepreneurs being trained in business, being trained in kind of project-based management, coming up with African solutions. The Tony Elumelu Foundation is a great example of that. He just did boot camp for 1,000 African entrepreneurs and pledged $100 million to African entrepreneurs who are addressing some of the most challenging of the social problems.
In 1984, when Vietnamese boat people were fleeing violence in Vietnam, and they were on the South China Sea and in the Gulf of Siam, and they were being preyed upon, that I felt this sense of injustice. So I left Georgetown University, where I was an undergraduate studying linguistics, and I went to the Philippines. The biggest lesson from living in a refugee camp, or 2 different refugee camps for almost 4 years, was that public health is about long-term solutions. We're not about quick fixes, and that the road forward was a little bit more complicated.
Anyone who wants to be a social entrepreneur, the first thing they should do is identify their passion and the problem that they want to solve. First and foremost, be honest about that. What is it that excites you? Because social entrepreneurship can be hard. The second is to really take stock. What are the assets you bring, and what's your interesting, novel, disruptive idea that how you're going to address that? The third is to look around. On the internet, you might find lots of resources, and the fourth is go get some training. There are lots of entrepreneurship training programs these days, and there are some great assets. The CUNY School of Public Health is starting a certificate program in not-for-profit management and leadership, where what we hope to do is inspire the next generation of not-for-profit leaders to take a systems approach to solving social problems and put community-based assets in the center of all of our healthcare.
So I think my legacy should be a willingness to go the extra mile and a willingness to be professionally generous to those who are just starting out, because people were generous to me.